my lozenge. Hello, everyone. So Ontario's healthcare system certainly is in crisis, and it is unacceptable that emergency rooms across the province were closed over 4,000 hours in the last year alone. People are going to hospital to discover there's not enough staff to treat them. But let's be clear that this crisis is by design. None of this is necessary that's being proposed today, and the situation is not normal. Doug Ford is deliberately suppressing healthcare workers' wages. He's holding back billions of healthcare dollars. He's trying to justify selling off our cherished public healthcare when he should be investing to fix the staffing crisis in the public system, spending the billions we know he's sitting on so we have a stronger public health care that's there when you need it. Privatizing healthcare will only drive even more healthcare workers away. And I believe, and we believe in the Ontario NDP, that he's pushing Ontario toward a two-tier healthcare system where the wealthy will be able to pay out of pocket to get faster, better care, and everybody else will be left waiting. The Doug Ford Conservatives are set on opening up our public health care to private shareholders, they're ignoring the public sector solutions that are out there, the innovative solutions that we know exist. As just one example, we could increase surgical capacity today by using operating rooms in the public system that are currently sitting empty. If we adequately funded the doctors, nurses, and anesthesiologists instead of suppressing their wages. We all know that a public healthcare system leads to better care than a two-tier, for-profit healthcare system because it puts patients' needs ahead of those of shareholders. I want to assure the people of this province that my NDP colleagues and I will spend every single day of this next session pushing for fresh solutions to fix the public system and not sell it off. We have some specific concerns regarding the legislation, and we're going to be looking at it more closely. But immediately, we have concerns about the lack of oversight. The fact that the minister stood here and said that this is to be determined. This is concerning to us. For example, we don't know, and we won't know, what the cost is of the services that are being provided versus how much the ministry is actually paying them. That's because, as the minister said, this is based on a business model. So we're getting signals here that we're not going to have all the information, and we won't have the transparency and accountability that this system needs. There is nothing in this legislation that actually prevents the siphoning off of workers. You know, these guardrails that the Minister of Health just talked about, they do not exist. There is nothing here to stop upselling. And the complaint process that's in place. Well, the complaint process isn't stopping upselling now or people being able to leapfrog up the wait list. And so this particular complaint process that's, again, being shopped around is inadequate. We have concerns about that. And I want to recognize as well our health critic, France Gélinas, who's here with me today. And we're happy to answer any questions you have.
One question I wanted to ask is, I've talked to several hospital executives in recent weeks, and they say there's not a lot of operating rooms free. And to do elective procedures in them kind of off hours, you know, when they're not doing scheduled heart transplants and stuff, they say that the outcomes aren't often good. Like if you've got someone who's 80 years old and getting their cataracts done, it's probably not a good idea to do them at, 10 o'clock on a Friday night, just because it's not a great time of day for someone that senior to have a procedure like that. So how do you address that kind of concern when you say open up more operating rooms that maybe aren't funded now?
I mean, I think there's two different issues there, really. But it's not that some surgeries can't be done outside of the hospital as we know it, right? But what we want to see is like when they talk about a community surgical center, this isn't necessarily a surgical center that's attached to a hospital or has a community board, right? It's a for-profit facility. These are the things, the factors that we think need to be considered there. We are hearing differently, that there are operating room options out there, that there are shifts that are not being used. And so I think, we raised these issues in the legislature today. We didn't get the answers we were hoping for from the government. And we're not convinced that this government has explored all of those options. As I said, to some extent, I think this is a crisis of this government's own making. We've got 22 or $20 billion in unspent public spending, that public dollars that haven't been used, that are just sitting there. We have at least $1 billion of that in the last year alone that was allocated for healthcare spending and didn't get spent. Why? Why wouldn't you spend every cent available to you as a government when a community and a province is in crisis? Why wouldn't you spend every penny and do absolutely everything you could? Why wait? Why make things worse? Why wait till ERs are closed for 4,000 hours in a year, and then suddenly a solution presents itself? Let's find a way for some people to profit off of this. To me, it's not convincing at all.
Marit, what do you make, though, in the press release the government sent out today, the OMA, the Hospital Association have quotes in there supporting this move? There's some caveats in there, but
I think if you...
Better than the OMA and the OHA, that's what they would say.
I think if you look at what the OMA's proposed in the past, that they're more interested in a public healthcare solution innovation. This government, again, has created a crisis, a situation, and it isn't just this government. It's been the last few governments, by underspending, by not actually making the changes and creating the innovation in our healthcare system and the public side. But this government has jumped on this bandwagon. Now they see an opportunity, right, clearly, for some people to make some money off of this. And what that's going to mean is that public dollars are going to profit and not to patient care, period.
Would you accept this if they just wrote in all these centers have to be nonprofit?
No, I think our concern is also that there should be community boards. They need to be connected to hospitals. There's a number of things that need to be in place for sure. But absolutely, there are innovations and ways that we could be looking at, again, innovation within the public healthcare system.
France, sur les pratiques de vente incitative, upselling en bon français, qu'est-ce que vous pensez du cadre qui est proposé ici?
What do you think about what's being proposed right now, where patients are... Is it sufficient what's being offered right now? Not at all. That's what's being offered right now in Ontario. And there isn't a day that goes by where I don't have 100 people that tell me, well, I had a choice between paying my ophthalmologist $200 more to do a second measurement of my eye and have my surgery in 2 or 4 weeks, or to wait in the hospital system 18 months. I need my driver's license. I can't wait 18 months for my cataract surgery, so I'll pay the extra $300. That's what's happening right now. It's happening a lot. There are very few people that are complaining because of the relationship between the one who's offering the services and the one that's receiving the services. And the Minister of Health knows it very well. The Auditor General has mentioned that this is an issue, and nothing's been done in the last 2 years since the report has been tabled. Question. We know that it's very complicated to complain within the system. We know how the system functions. But for a regular patient, it's much more difficult. Answer, yes, absolutely. There's no accountability. We're not ensuring that that there's oversight. I have nothing against the Ombudsman, but he provides recommendations. He doesn't have the ability, the authority to change the situation. Right now, complaints are formulated to the Ministry of Health, and nothing happens. So to send this to someone that can make recommendations but isn't in a position to change anything won't improve the situation. And
if you look at the 52 large community hospital, this is where you will find all of the empty OR. Health Sciences North, 3 of them brand new, never open. They get dusted, but they don't get used. That's Monday to Friday, day shift. They don't get used. And that's, if you look at the tertiary care hospital, with some of the one you were looking at, they tend to be, their OR tend to be more busy. The large community hospital, we have 52 of them. This is where the OR sits empty.
I'd just like to repeat something that France said in English about the ombudsman and that system that's being proposed by the government here for complaints. As France was saying, the ombudsman can make a recommendation, but they can't implement policy. They can't make the change happen. And so that's very significant, right? In addition to some of the other points that France was making about how a patient may feel that they aren't in a position, they may be intimidated in a situation where they're being offered a particular service or being upsold something. So the chances of somebody making a complaint or saying, no, I don't think that's a good idea in the moment are limited anyways. But even if they do make a complaint to the ombudsman can only make recommendations. And also, let's be clear, the ombudsman is overwhelmed already with the number of complaints and the amount of work that's being sent over to them. So it's certainly not an adequate complaint process at all, or any kind of guardrail, as the Minister of Health said.
And connected to that, this notion that they have said there will be a regulator, we can't tell you who it is yet. Can you comment on that? Wouldn't it make more sense to have your ducks in a row? You're doing this thing, people are uptight about it. Shouldn't we know who this regulatory body is going to be?
Yeah, absolutely. As far as I can tell, there is no oversight. There's the promise of some oversight sometime, somewhere, to be determined. There's also no limit on the number of these clinics that the government's going to open, which to me says, they're just going to go bananas. I don't see how, I don't see any kind of limit to this. We don't see any kind of clear regulatory body. And what we see in terms like the business model being used as an excuse for why they can't share certain information is less transparency, less accountability in our healthcare system.
Can you also go back to your comment about how this opens the door or paves the way for two-tier healthcare? I mean, the government would counter saying, look, everybody who goes to one of these things is going to be, their procedure is going to be covered by OHIP. Let's leave aside the current problems with upselling and so on, because we don't have we think we have a single tier healthcare system now. So how does having these clinics with publicly insured services get us to a two-tier healthcare system where rich people get better care and poor people get worse care?
They have to make a profit, right? They've got to make a profit. They are by nature for profits. That is what they are. They're businesses. They have to make a profit. So they're going to be looking, and we know, as you said, these already exist within the public healthcare system, but at least there we're properly regulated. There's procedures in place. This shouldn't be happening. France Gélinas, our MPP Gélinas, brought forward a bill to try to actually address the failure of this government to stop and to properly regulate and to put in place to penalize clinics for upselling right now. This government has shown they have no interest in doing that, in really cracking down. So absolutely, I mean, the obvious opportunity here, without question, is that they are going to be able to offer services where you could potentially bump yourself up the wait list, and also consider the fact that, and I will share another way of looking at this too, though. If you're going to have a system which is then attracting and pulling more healthcare workers out of our public healthcare system, which is what will happen here. I mean, I'm hearing from hospitals, but also from long-term care facilities who are saying, we're going to lose the few people that we have working there already because these private for-profit facilities are going to be able to offer them higher wages, better shifts, better working conditions maybe, right? So if you're going to have that situation, who's going to be doing the work in the hospitals, in the public healthcare system, to provide people who have more serious surgical needs or healthcare needs with the care they need? There will be a two-tier system here. This is the beginning of it, and this government is opening that door.
France, juste pour revenir sur nos questions précédemment posées.
I'd like to ask you another question, France. If this isn't meant just for nonprofit clinics, do you think they could be part of the solution is if it's only offered for nonprofits? to offer better services is always something that we've supported. Hospitals can open surgical clinics within the community, but it's their doctors that offer the treatments. It's their employees that will be working in those centers. 1 week you can work from Monday to Friday from 9 to 5, but the rest of the time you have to work at night, on weekends, holidays, because hospitals offer their services 24 hours a day, 7 days a week. So yes, to offer services in the community, it's a great idea, but you need to collaborate with hospitals so that not everyone leaves the hospitals to work Christmas when you can work Monday to Friday during the day, and that you're getting a better salary within the community than in the hospital. Well, what would you choose? Well, we're all human beings.
Merci.